Good day. Thank you for the invitation. And now we will discuss about emerging infectious disease risks for travelers to Latin America. I'm Alfonso Rodriguez Morales, and unfortunately, I'm not on site, but I am here to present this lecture. These are my potential conflicts of interest. I will not discuss directly on vaccines, but however, I have been collaborating with some companies in the field of vaccines, especially for arboviral diseases. This is what we will discuss. We will discuss a little bit what is happening from the epidemiological overview, and then we start to discuss the situation with some of these important emerging diseases in Latin America, including dengue, chikungunya, yellow fever, Oropuche, among others. From an epidemiological overview or point of view, it's important to mention that Latin America is a region, a vast region with more than 670 million people, which is mainly young, living in these areas with a median age of 31 years old and with conditions that are prone from social and from ecological point of view for the presence and the development of multiple tropical diseases and zoonotic diseases particularly. And right now, especially in the context of climate change, it's also important to consider that emerging and reemerging diseases are important, especially from the point of view that these may be in connection with the alteration of different cycles, including that, for example, some diseases, some vectors in particular, are spreading in a different way, increasing their distribution by latitude and even for altitude, as has been observed in different reports and evidence regarding this. And in the case of emerging arboviral diseases, not only dengue, but others as we will discuss, this is especially important for mosquitoes such as Aedes aegypti, albopictus, that are important in certain countries where even emerging diseases may overlap, as was the case, for example, during the epidemics the last decade in Colombia with dengue, chikungunya, and Zika. But also, this is highly important to consider that in the febrile syndrome in Latin America, you may consider not only one or two, but many different conditions that may even overlap or even produce co-infections, as this is one case that we always used to remember, that a fatal case of dengue, chikungunya, and leptospirosis here in Colombia. From the evolving conditions, for example, right now we have also new vectors for certain diseases, such as is the case of the Aedes vittatus, that this is a competent vector that has been reported in certain Caribbean countries, and this is concerning regarding the implications for dengue and other arboviral conditions. But from a social point of view, it's also important to remember that we are underdeveloped still, and then we have these prone conditions, and even this is associated with the migration in the region that is also associated with multiple infectious diseases, the problem in the Darien Gap, right now also concerning with the emergence of Oropuche, as we may discuss later. And in fact, this has been also part of the discussions on the global research agenda on health migration and displacement. But certainly, these diseases are multifactorial, and these are important in the context that, for example, arboviral diseases such as dengue and chikungunya are among of the most common in Latin America right now. And these are related to multiple factors, multiple determinants at a pathogen level, economical, health system, and obviously from the environmental point of view. But in addition to that, it's also important to mention that we have other emerging conditions, as we will discuss later, which is, for example, the case of Oropuche that never caused a major epidemic in the region, just really some sporadic outbreaks in certain areas, in addition to other emerging diseases that may be a cause of concern in the last decade, for example, as we mentioned, chikungunya, but later the case of Zika. And precisely, chikungunya was a matter of concern years ago, and it came here to Latin America from Africa to generate different epidemics, especially in the last decade in North South America, in countries such as Venezuela, Colombia. In the first year of the epidemic, more than 1 million cases were reported in the region. But closely to that, there was a very important second epidemic of Zika. Zika, as you remember, was declared an emergency, international emergency of public health concern in 2016. And this was especially important, not only in Brazil, but in many other countries, and obviously affect travelers also to the United States, to Europe, and other countries with the concerning matter of the impact in terms of the pregnancy with the congenital Zika syndrome. But it's important to remember this is still circulating in Latin America. In different studies, we have shown that there is still significant seroprevalence for Zika, for chikungunya after those epidemics. But certainly, if we speak about important risk for travelers in Latin America, probably dengue is among amounts of the first, and dengue has been evolving significantly over the recent years. And you may see here, for example, in 2023, for more than 4.5 million cases. But last year, 2024, more than 30 million cases were reported in the region. And we have the co-circulation of the different serotypes, and especially in some countries, there is reemergence of the serotype 3, which is also important. But in addition to dengue, it is important to discuss what is happening with a disease, an alpha virus that in fact has not only an acute form of disease, but also a chronic consequences with disability and impact, significant impact on cost, which is the case of chikungunya, that in some countries recently, as is the case of Paraguay, but also Argentina, Bolivia, and even Uruguay, that was not endemic before, is also causing concern in addition to other significant problems, such as has been mentioned before, the case of dengue for Argentina, that is facing recently dual epidemics of dengue and chikungunya, in addition to other countries, such as is the case of Paraguay. In Latin America, then countries such as Brazil and Paraguay are really important also for chikungunya. And the last year, more than 220,000 cases of chikungunya were confirmed. But right now, we are in the middle of two important epidemics. This is the case of yellow fever and Oropouche, and this make more complex the scenario for the overlapping causes of the different febrile syndromes. And then we need to think in chikungunya, in dengue, in Zika, but also even in Mayaro. Mayaro is another matter of concern, in addition to other conditions, such as is the case of leptospirosis, or maybe other emerging conditions that, for example, in the last 2 decades, such as is the case of acute Chagas disease, has been causing different outbreaks, especially associated to the oral consumption of contaminated juices, in addition to other classic situations, such as the case of leishmaniasis, the important situations we face with mpox, among some endemic arenaviruses that we have also here in Latin America. In this recent book, we discussed that with my friend Rodrigo and Jeremy from Brazil, in the region in general and country by country, which are the main important diseases that are causing activity in the last 10 years. And you may see here other conditions that are important. For example, from fungal diseases, is well known that here in Latin America, for example, is very important, paracotsi, among, for example, other conditions that are endemic is in some countries, such as is the case of trichinella or the case of hantavirus, among other conditions. But as I mentioned, we are facing now an epidemic of yellow fever. Yellow fever is well known in Africa and here in South America. And in the last few months, has been a matter of concern. But this is also recurring in different countries of Latin America, especially associated with the lack of vaccinations. For example, what happened a few years ago in Venezuela with that, many years without reporting yellow fever, but because of that, start again some years ago to reporting yellow fever. But this is also the situation in other countries, such as is the case of Brazil, Bolivia, Peru, and right now, especially in the case of Colombia. Obviously, we have a complex zoonotic disease with the jungle sylvatic cycle, which is important, obviously, to discuss. And last year, here in Colombia, we started to face the rise in the number of cases of yellow fever. And this was the situation in one of the region in the south of the country, Putumayo, that because of that, in addition to other departments later here in Colombia, as you may see here in this recent publication, we start to face these cases. And for example, in Putumayo, in last year, we have initially 4 cases, and these 4 cases were in unvaccinated population. And obviously, this developed severe disease with a fatal outcome, and in association, as I mentioned, with the lack of vaccination that we have for the last year. But again, this is right now affecting other countries, not only Colombia, but Peru, Brazil, Bolivia, and even the Guyanas. And you may see here that in the last 2 years, 2024, and right now in 2025, this is particularly important. And so far, for April, we have more than 189 cases that have been reported of yellow fever, 39% of them with fatal outcomes in these countries. And you may see what is happening right now in this year regarding a yellow fever. But we have a long history of yellow fever in multiple countries in the region. You may see here that the numbers, especially in the 90s. So we have to keep in mind this. But right now, especially in some regions of Brazil and Colombia, such as is the case, for example, in Brazil of the state of Sao Paulo and Minas Gerais. Minas Gerais is important, but in the case of Colombia right now, Tolima especially is affecting. But other conditions also may keep in mind, not only from the occurrence here in Latin America, but including what is happening with travelers. And this is the case of Mayaro. And you may see here that Mayaro, which is endemic in Latin America, reported initially in Trinidad and Tobago in the 50s, as well, Oropuche, that I will discuss later. This has been with imported cases in Europe, for example, in France, in Germany, among other countries. And then this is important also to consider among returning travelers from Latin America. But in addition to that, here we have West Nile, which is more common in other regions, but we have many other encephalitis, especially Venezuelan equine encephalitis, and right now, especially the reemergence of Oropuche. In addition to that, recently Usutu has been also reported, and this was concerning regard the possibilities from many years ago in the discussion regarding of imported cases from Europe or from Africa, that is the origin. And last year there was this report showing that probably we have also Usutu here in Latin America, and particularly here in Colombia. So many emerging and reemerging diseases are important here in the region. Some of them sometimes are neglected, as is the case of Mayaro, Madariaga, St. Louis, Rocio, and the case of Oropuche. And obviously, many of them overlap clinically, and this is also important to consider. The case of the different equine encephalitis, the West Nile, the Venezuelan, the Eastern, and the Western, which are also here. But right now, I would like to discuss briefly what is happening with Oropuche. Oropuche is all arbovirus discovered in Trinidad and Tobago in the 50s, is an orthopunja virus. And this has been under discussions for many years ago regarding the possibilities of new areas to be affected by this emergent disease. And this is the case not only of Brazil, but the important increase in other countries in South America over the last year, especially, but with new concerns because it has been associated with in some cases of fatalities, but also with vertical transmission, with the risk of possibilities of congenital defects, which is still under investigation, has been not classified yet as a teratogenic condition, but is still under investigation because has been reported associated also with pregnancy loss, vertical transmission, and especially in Brazil, some cases even reported significant birth defects at the central nervous system, such as is the case of the genesis of the corpus callosum, recently reported, has been in the literature, and more cases are right now reported with Oropuche. But Oropuche is reported in travelers coming to Latin America. And this is interesting because this has been reported, for example, in Europe, returning from Latin America to Italy, for example, from Cuba, that is right now especially affected, and Oropuche may lead to neurological diseases, to encephalitis, to Guillain-Barré syndrome, as well others. And this has been right now under analysis under not only such diseases, but especially neurological manifestations, and not only, as I mentioned, in central nervous system, but also in the peripheral nervous system, including Guillain-Barré syndrome and other conditions. But it's interesting associated with the travelers that new situations has been reported, and this is the case of the viral persistent and even the detection of Oropuche in semen, with the implications that has cytopathic effect at the barrel cells culture, which is interesting because may lead to the discussion if it's possible sexual transmission associated with Oropuche, as has been discussed for other arboviral diseases, especially the case of Zika. But in addition to that, maybe we have to include Oropuche and this emerging risk of sexual transmission with this arboviral disease. And at the same time, we have to remember not only for Oropuche, but for many other viruses, that we have the possibility of the transmission by blood transfusion and transplantation. And we have to keep in mind right now in this epidemic of Oropuche that is increasingly in the last year, this possibility as this virus has a phase of viremia viremia. And obviously, among travelers, this has been reported. This is the case in the United States from people returning from Latin America, especially from Cuba, but in other countries, as I mentioned, in Italy, but also, for example, in Germany, now in Spain, in Canada, this has been also reported. So we need to keep that in mind. Here, for example, in Colombia, we have different departments where Urupuche has been reported over the last few years. And this is a matter of concern in general in other countries, as has been the case of Brazil, Peru, among others. Last year, Bolivia, Canada, Peru, Ecuador, Panama, Cuba, Colombia, Cayman Island, Barbados, Brazil, and United States, as I mentioned, Guyana, report more than 15,000 cases of Oropuche. And some areas are under particular risk. This is the case of Darien Gap, which is an important place for the migrant crossing, trying to reach other countries, including United States, and there has been reported. And in 2025, this year, you may see that more than 9,000 cases of Oropuche has been reported so far. New countries have reported this, and this is the situation in Venezuela, that in certain areas, as you may see here in red, Barinas, Portuguesa, in the capital, had reported cases, but they have the vector in other areas, so there's a risk for that. In addition to that, recent studies also on seroprevalence have highlighted, for example, countries such as Costa Rica that never reported cases of Oropuche, but right now it has some studies such as this reporting seroprevalence. Even here in Colombia, this study report also the retrospective detection from serological samples from more than a decade ago, before the first case was reported in 2017. So what is happening? Many questions to be answered in the next few months, but it's important to keep in mind that if you have fever with neurological symptoms, this in Latin America may be associated with Oropuche. And we are still researching about what is happening with the vector, but that is important to keep in mind. From the Pan American Association of Infectious Disease, we have provide some algorithms for diagnosis of Mayaro and Oropuche. And right now we are collaborating with the Pan American Health Organization regarding the definition of research questions for what is right now going on with Oropuche. Some final conclusions. We may say right now that, especially from the arboviral point of view, there is a reemergence and expansion, especially in the case of chikungunya. Also, we've seen that before for Zika. Right now, with yellow fever and Oropuche, we have to remember that we have also different equine encephalitis in the region. Obviously, with emerging diseases, always we have different associated key factors, including climate change, uncontrolled urbanization, that right now we are concerning, for example, in yellow fever, with the possibility of peri-urban transmission, the social crisis and poverty that is important in some countries. We may have the possibility of co-infections. Recently here in Colombia, we have a case of fatal yellow fever associated with a confirmed co-infection with Oropuche. We may have chronic complications, especially in chikungunya, but among other emerging diseases, and in some of them, the neurological complications that in the case of Oropuche is important to mention. Oropuche then is a new threat with different implications still under investigation. What is important to remember, Usutu, Mayaro, maybe also another problems that we have to keep in mind. Obviously, for many of these viruses, we have the vaccines. We have vaccines for yellow fever. Right now, we have vaccines for dengue, for chikungunya. And then it's also the urgent need to strengthen the vector control programs and proactive vaccination strategies, as well also education. And for the future, the question is when, not if, we will see for sure new epidemics of emerging arboviruses or another emerging conditions in the region. And it's important the continuous epidemiological surveillance, epidemiological research, and the development also of predictive models of outbreaks, among other things that are finally crucial. I would like to close, giving thanks for your attention. And right now, this will be, after this, a space for discussions on these topics. And I would like to close my presentation saying what the poet Luciano Garcia Gomez said, that in Pereira, there are no foreigners. We are all Pereirans. Thank you very much for your attention.